Welcome to another video. We will discuss the difference between depression and anxiety in this video because in many cases they are considered to be the same whereas they are different issues. Anxiety and depression are types of mood disorders. Among other things, depression causes feelings of sadness, hopelessness, and reduced energy. Anxiety creates feelings of nervousness, worry, or dread. Although the two conditions are different, you can have both at the same time. Agitation and restlessness can be symptoms of both depression and anxiety. It's normal to have feelings of anxiety or depression from time to time. But when these feelings happen often and they interfere with your life, you might have a disorder that's treatable. Your symptoms can help your doctor figure out which of these two conditions you have, or whether you have both. Some of the same treatments work for anxiety and depression. Depression affects how you feel and act. When you're depressed, you may have symptoms like sadness, hopelessness, or anxiousness. Loss of interest in things you once enjoyed. A lack of energy. Eating more or less than you used to. Sleeping too little or too much. Trouble thinking or concentrating. Whereas anxiety can be defined as worry and fear are normal parts of life. But when these feelings don't go away or they're excessive, they can be signs of an anxiety disorder. You may have a problem with anxiety if you often feel overwhelmed by worry, cranky or on edge, sweaty or shaky, like you are out of control. The main difference between depression and anxiety is the symptoms. Depression is a persistent feeling of sadness. You also have no energy and you lose interest in activities you once loved. Some people with depression think about hurting themselves. Anxiety involves fear or worry that you can't control. Depending on the type of anxiety you have, the worry can surface during everyday activities like meeting new people. Both depression and anxiety are very common, and they often happen together. About 60% of people with anxiety also have symptoms of depression, and vice versa. Each condition can make symptoms of the other get worse or last longer. The same genes may be behind both conditions. Anxiety and depression could also stem from the same structures or processes in the brain. Stress and trauma early in your life can trigger both depression and anxiety. If you have anxiety, you may be at a greater risk for depression. It can be harder for doctors to diagnose and treat depression and anxiety when they happen together. That's why it's important to tell your doctor about all of your symptoms. Treatment for anxiety and depression involves talk therapy, medication, or a combination of the two. We will be discussing anxiety and how to manage it in a detailed upcoming video. Thank you for watching. Take care of yourself and your loved ones. We'll meet again inshallah with a new video.